Vanakkam. Talk here, talk there. As doctors, apart from the medical work that we do, we need to talk a lot on the professional front. We need to talk to our colleagues, our seniors and administrators, our juniors and budding doctors, and to our paramedical colleagues also. And most importantly, we need to talk to patients and anxious attenders and caregivers. Though the basic idea is the same, that is, to get the message across in each of our communications, there are differences between each of these and important features of each of these interactions. Let us draw from the treasure house of knowledge, that is the ancient Tamil treatise, the Thirukkural, to understand these types of communication and how to talk with different people. In the course of their profession, everyone would have to talk to many people, many kinds of people. And as doctors, we also need to talk to many kinds of people. We need to talk to our colleagues and staff nurses. We need to talk to our seniors and administrators. We need to talk to our junior doctors, the budding doctors of tomorrow. We need to talk to the paramedical staff, and most importantly, we need to talk to the patients and their anxious caregivers and attenders. The way we talk and the way we interact with each of these categories of people is going to determine how our work atmosphere is going to be, how we are going to progress in our professional career. And to understand how it is that we need to talk to these people, let us draw upon the ancient Tamil treatise, the Thirukkural, which gives us insight into how communication should be. As far as talking to our colleagues and staff nurses is concerned,
உணர்வது உடையார் முன் சொல்லல் வளர்வதன் பாத்தியுள் நீர் சொரிந்தற்று பாத்தியுள் நீர் சொரிந்தற்று.
Definitely sounds wonderful, but what does it mean? The words unarvadu udayar mun refers to people who are as knowledgeable as you. The word sollal refers to talking to such people. Valarvadan means a growing, here refers to a growing plant. Patiyul, the pot in which the plant is growing. Neer sorindatru is similar to watering these plants. Unarvadudayar mun sollal valarvadan patiyul neer sorindatru. Pouring water to a plant in a pot which is being well cared for is very superfluous. So we need to keep our communication with our colleagues the bare minimum that is required for the professional conduct. We must remember that our colleagues and staff nurses are also knowledgeable. We need to give them the due respect they deserve, appreciate the good things they do. Even if some mistake has been committed, it has to be pointed out very tactfully. Decorum in our behavior to colleagues and staff nurses is very important. When we need to interact with our seniors and communicate with them,
நன்று என்றவற்றுள்ளும் நன்றே முதுவருள் முந்து கிளவாச்செறிவு முந்து கிளவாச்செறிவு.
நன்று என்றவற்றுள்ளும் or நன்றென்றவற்றுள்ளும் refers to of all the good things. Nandre, the best is muduvarul, that is when in the company of elders, seniors or well learned people. Mundu refers to the first or in a hurry. Kilava refers to not talking. Cherivu is good habit. So நன்றென்றவற்றுள்ளும் நன்றே முதுவருள் முந்து கிளவாச்செறிவு. When in the company of seniors or elder people or well learned people, do not rush to give your opinion. Wait for them to ask you to talk before you give your opinion. That is the best of all good habits. So, respect we must give, but we must also get our point across in the same respectful manner. If we happen to disagree, we must do so very agreeably. Nowadays, there is a strong tendency for sycophancy, which is creeping into our field. It must be nipped in the bud. The like for being praised is basic to human nature. It is like a fire. We must not add our bit to fuel this fire, to fuel this bad fire. When talking to juniors, they may be our junior colleagues also, and also budding doctors, we need to be very careful. Our communication with them needs to be like this.
இனிய உலவாக இன்னாத கூறல் கனி இருப்ப காய் கவர்ந்து அற்று இனிய உலவாக இன்னாத கூறல் கனி இருப்ப காய் கவர்ந்து அற்று.
இனிய உளவாக refers to that which is sweet. இன்னாத means does not have. கூறல் refers to the speech or the words that we utter. Kani iruppa, kani means ripened sweet fruits. Kai kavarndatru, choosing or preferring the raw sour fruit. Iniya ulavaga innada கூறல் kani iruppa, kai kavarndatru. When we talk, we have the option to choose our words. A person who chooses rough words or a rough language that hurts, it is like choosing the raw sour fruits when the option of sweet ripened fruits are available. Junior doctors are the future of the medical field. They must be taught the correct behavior. Giving them respect will ensure that the trait will be passed on the way that person is going to treat his juniors. Why I chose this Thirukkural was that we need to choose the sweet words just like we choose the ripe and sweet fruits. And it is the fruits that bear the seeds of respectful behavior, talk and attitude to our juniors. The juniors may be interns, postgraduates or even undergraduate students. Even our junior colleagues should be treated with respect. The aim of our medical work is to provide a complete treatment for the patient, and this can never be complete without the contribution by the paramedical workers. When we talk to them,
தீயினால் சுட்ட புண்ணுள்ளாரும் ஆராதே நாவினால் சுட்டவடு நாவினால் சுட்டவடு.
தீயினால் சுட்ட புண் refers to the wound that is caused by a burn. Ullarum will heal. Arade refers to what will not heal. Navinal, the hurt or the wound caused by the tongue, that is harsh words. Suttavadu, the wounds caused by harsh words. தீயினால் சுட்ட புண் உள்ளாரும் ஆராதே நாவினால் சுட்டவடு. A wound caused by a fire, that is a burn, can also heal. But what cannot heal easily are the wounds caused by harsh words. As I said, no work can be done successfully in the medical field without the help of paramedical workers. They should be taught the correct ways, and we need to choose words carefully when we address them, keeping in mind that though they are not knowledgeable about the work we are doing, they are here to help us, and they deserve respect too, though always being in the background. If possible, a kind word would go a long way in improving their work attitude. All said and done, the entire focus of the medical profession is on one single category of people, the patients and their attenders. The communication of the doctor with the patients must be in this way.
முகத்தான் அமர்ந்து இனிது நோக்கி அகத்தானாம் இன்சொல் இனிதே அறம் இன்சொல் இனிதே அறம்.
The words முகத்தான் அமர்ந்து refers to the face, the facial expression. The word இனிது நோக்கி refers to a welcoming look because இனிது means sweet and நோக்கி means look that is given. அகத்தானாம் refers to from the heart, from the soul because aham means the heart or the soul. Insol refers to good words. Insol inade aram means uttering good words is a virtue. முகத்தான் அமர்ந்து இனிது நோக்கி அகத்தானாம் இன்சொலினதே அறம். Thiruvalluvar has actually said this kural or couplet to describe how a person should greet a visitor. I feel it is apt for the doctor-patient relationship also. A good smile and the utterance of good words will welcome the patient and also make him confident. The doctor will be able to win the trust of the patient, and this is very important because the patient has to confide in the doctor about his or her problems. So this would be a very good starting point for the doctor-patient relationship. At the same time, the good words that the doctor is uttering will also instill confidence in the patient that he or she will get a good treatment from this doctor. Patients are the most important part of our work. In fact, they are the very focus of all our work. The trust they have placed in us should be respected. The very first response that we give the patient is our talk, the way we approach them, the body language, and most importantly, the words we choose to talk to them. A smiling face, a positive attitude, and a kind word go a long way, and this is not only during the first visit but during every single visit, even if the patient has had a complication. I hope you liked the video. I enjoyed making it. Please click on the shown links to see more about what the Thirukkural has to offer and how we as doctors can interpret it. And do not forget to subscribe to stay connected with the latest in learning hand surgery, plastic surgery, trauma surgery and ethics. Vanakkam.